Peripheral arterial disease, or PAD, might sound like a mouthful, but it's a condition that affects many people. In simple terms, PAD means that the arteries carrying blood to your legs and feet are becoming narrowed. This narrowing reduces blood flow, and that can cause a whole host of problems. It's like a hose pipe with a kink in it. The water struggles to get through. PAD is actually quite common, especially as we get older. But the good news is that with early diagnosis and the right management, you can keep the symptoms under control and live a full and active life. So let's dive in and learn more about PAD, its symptoms, how it's diagnosed, and most importantly, what you can do about it. Remember, knowledge is power, and understanding your health is the first step towards feeling your best. In the next section, we'll look at the common symptoms of PAD so you know what to look out for. One of the trickiest things about PAD is that sometimes it doesn't have any obvious symptoms in the early stages. That's why it's so important to be aware of the potential warning signs, especially if you have any risk factors like diabetes or smoking. So, what should you be looking out for? A very common symptom of PAD is pain in your legs or calves when you're walking. This pain, often described as a cramping or aching sensation, typically eases when you rest. It's your body's way of saying that your leg muscles aren't getting enough blood flow during exercise. Other signs to watch for include numbness or tingling in your feet, coldness in one leg compared to the other, and sores or wounds on your legs or feet that are slow to heal. It's important to remember that experiencing these symptoms doesn't automatically mean you have PAD, but it's definitely a sign that you should get checked out by your doctor. Early diagnosis is key to successful management of the condition. Now that we know what to look for, let's move on to how PAD is diagnosed. If you're concerned about PAD, your doctor will start by asking about your medical history and symptoms. Then they'll likely perform a simple, painless test called the Ankle Brachial Index, or ABPI. This test compares the blood pressure in your ankle to the blood pressure in your arm using a blood pressure cuff and a handheld Doppler device. A lower blood pressure in your ankle compared to your arm can indicate PAD, as it suggests there's a blockage affecting blood flow to your legs. Your doctor may also examine your legs and feet, checking for pulses, temperature, and any signs of wounds or ulcers. These simple checks can provide valuable information about your circulation. Diagnosing PAD is the first step towards managing the condition effectively. In the next section, we'll explore the common causes and risk factors associated with PAD so you can understand what might be contributing to your risk. Like many health conditions, peripheral arterial disease is often linked to lifestyle factors and underlying health issues. One of the biggest culprits is smoking. Smoking damages your arteries, making them more likely to harden and narrow, restricting blood flow. So, if you're a smoker, quitting is one of the most important things you can do for your vascular health. Another major risk factor is diabetes. High blood sugar levels can damage the lining of your blood vessels, increasing the risk of plaque buildup and narrowing of the arteries. Other contributing factors include high cholesterol, high blood pressure, and a family history of peripheral arterial disease. Understanding the causes and risk factors associated with PAD empowers you to take proactive steps towards prevention and management. In the next section, we'll delve into the various treatment options available to effectively manage PAD and improve your overall health. The good news is that peripheral arterial disease is treatable, and there are things you can do to manage the condition and improve blood flow to your legs and feet. One of the most effective ways to manage PAD is through lifestyle changes. This includes quitting smoking if you smoke, eating a healthy diet low in saturated and trans fats, and getting regular exercise. Walking is particularly beneficial for people with PAD as it helps improve circulation and strengthens leg muscles. Your doctor might also prescribe medications to help lower your cholesterol, control your blood pressure, and prevent blood clots. Remember, managing PAD is a journey, and every step you take towards a healthier lifestyle contributes to better blood flow and overall well-being.